I'm Anna Taft, Executive Director of the Tandana Foundation, which works here in this parish of Kichinche on education, scholarships, educational projects, and cross-cultural volunteerism and service projects. And this healthcare volunteer vacation forms part of those cross-cultural volunteer efforts. And here we have a wonderful group of 11 volunteers from the United States who are here to provide medical care to these 5 communities, and they're all having a wonderful experience. They've come with lots of energy and lots of great ideas. And
So,
okay, señora, eso tiene que dar al guaguita en la boca. Sí, todito eso.
so
My name's Julie Anderson. I'm from Montana and have done a lot of indigenous work, primarily with the native Eskimo people in the Bering Sea. I work I have a family practice in Montana and in the Eskimo village, and have decided to come to Ecuador 2 or 3 times a year. I came last year for the first time and invited Jim Hoyne, who's another physician, and another group of people who have all come as a team, and we hope to continue to come here 2 or 3 times a year and work as a team to provide health care in the communities. My personal wish would be that we are able to implement what we use in Alaska in the indigenous tribes, and that is the health aid program, where indigenous people are trained to take care of their own through more or less a cookbook with symptoms that people come in with, and they follow a certain array of questions, and that is sort of an algorithm into how they're treated. It's a model that works extremely well in Alaska. They go through 4 different phases of health care, and by the time they're finished, they are a community health practitioner and very accomplished at taking care of most of the health needs in their community.
Okay. Back to school. Baby, blood pressure, temperature.
Mira hacia arriba.
And the dust gets to her and causes these eyes to get so
Dice el
inflamed.
doctor que es por el viento y el polvo. Okay? Entonces lo ves.
My name is Marcella Bernathy. I'm from Michigan. I'm here with my daughter, who is a PA from Montana. And I came at her request. I didn't really think I would be able to manage this trip. I'm 83 years young. The altitude has really not bothered me because they're not overworking me. I'm amazed at the way these people live. I am amazed at the way they accept this way of living. And I am ashamed at what we have. They have so little and we have so much. So I consider it a privilege to be here, and I thank God.
Están bien los oídos.
Está bien.
Los ojos, mira acá.
Boca.
Abre la boca. Y saca la lengua.
Diga A.
Diga A.
Okay. Good.
Mira mi mano. No te muevas. Okay. El otro ojo, mira mi mano. Okay.
Yeah. Okay, so no signs of cataracts.
No tienes mucho signo de cataratas.
No,
Okay.
no.
Estás bien.
esperar, dijo.
No, el doctor te está diciendo lo que tienes. No tienes mucho signo de cataratas.
De repente me duele hace noche cuando salgo.
Okay.
Hello from beautiful Ecuador. My name is Jim Hoyne. I'm a board-certified family practitioner. I work in Montana in the Bozeman area. For a lot of years I've been looking for a place to come down and do health care for a population that has no health care. Last November, I ran into a woman by the name of Julie Anderson, a PA in Livingston, Montana, who told me about an upcoming project in the 5 community areas out of Otavalo in Ecuador. They were putting a package together with the Tandana Foundation, Anna Taft, who runs cross-cultural awareness for both young Ecuadorian and American women. This is a non-government, there is no NGOs, and it is not affiliated with any particular religious group. It's just a group of medical volunteers who are looking to put their skills to use in a country that needs help and has limited resources from their government. I have to admit that initially, Tandana, Anna Taft, for that matter, Julie Anderson, and I was a little concerned about what it would be like to come down here. But 6 months ago we came down, mainly on a fact-finding mission to see what the needs were and how we could be of help. What I found was a wonderful group of people, a wonderful community leaders, a gentleman by the name of Frank Kiefer, who was already gathering volunteers for educational, medical, water resources for the people in these 5 communities. Around the area here in Otavalo, there's approximately 28 communities of indigenous who all are in need of help. Rather than stretching ourselves too thin, we decided to try to focus on 5 communities, see what their needs. We're not coming down here as people who say, this is what you need to do for your health care. We're trying to come down here and say, how can we help you? How will this fit in your cultural context? How can we help you take care of your families and yourself? We don't make people come here. We don't make them have particular treatments or try to fit to our Western ideas of medicine. We come down with drugs, our knowledge, and experience and say, utilize us. Tell us how we can help. The first time we ended up seeing over 400 patients in a 5-day period of time. About half of those were health exams on children who had never really been seen. The government does provide immunizations. They provide rudimentary care for parasites, but beyond that, most of these children had never had a routine health screening. We came down to listen to hearts, lungs, look for dental issues, orthopedic issues, things that may possibly be helped by a referral. In addition, we tried to do some health care for the adults. We found a lot of people having abdominal pain, chronic abdominal pain for many years. It led me to do some research when I came back and found out that the incidence of H. pylori in this community can be as high as 80 to 90%, whereas back in North America with chronic dyspepsia and abdominal pain, it appears to be more 30 to 40%. Based on that, when we went home, we came up with some protocols, what types of things we would be looking at here, how we could most effectively treat them. These included abdominal pain, urogenital infections, eye infections, dental issues, but somewhat of a focus on identifying this chronic abdominal pain. I did contact a company, Henry Schein, who makes the H. pylori test that we could use here. It's very simple. I can do it with a finger stick capillary blood and about 10 minutes later have a very accurate result. I ended up bringing about 40 of these tests down on this trip. This trip, instead of just being here for 1 week, I've been here for 2 weeks. I spent the first week with 2 other medical providers, Julie Anderson, who I mentioned before, who came back down with us, and a number of wonderful volunteers from the States. We went to the 5 different communities, set up a system where we would register people in, have a rudimentary medical record, give them as a complete exam as it would allow in the facilities that we had here, and then we could do a few tests. We could do the test for H. pylori, we could do a urine dip, we could do a pregnancy test. Based on that history, we could go ahead and prescribe some treatment. I came down about the week before we did this to talk with some local providers that I had talked to last time. Dr. Sonia Garcia, who's been very helpful, a family practitioner in the large town nearby of Otavalo, to talk about how they addressed indigenous, what exams would be appropriate culturally here, how we might be received. Would we run into problems with the local medical community? Would they feel that we were interlopers coming in? She assured us that so little was available to the indigenous population, mainly subsistence farmers who had no cash, that they would welcome us coming down and helping out. Based on that, we used our protocols and had a very productive week, seeing over 200 acute care people. Interestingly, our H. pylori's, we ended up doing approximately 16 tests and had 11 to 12 positives. Maybe not as high as the 80 to 90% that we've seen in the papers, but certainly higher than our North American counterparts at 30 to 40%. And this was the first time. We really haven't got all of our criteria exactly together yet to know exactly who we want to test and how we're going to test.
We came last March with a smaller group, and we've taken what we learned from the diseases we saw and our experiences from how things worked organizationally that time and tried to improve upon them here. One of our doctors did some research, and we brought some tests that we thought would be very useful, and so we've expanded our repertoire here. And our goal is to be able to come every 6 months and provide general medical care to these 5 communities.